Um, Got it. So welcome to our May Career Development Seminar for our GloCal program. If I understand correctly, this might be our last career development workshop for this year. Christine, is that correct?
Yes.
Okay. All right. So we saved the best for last. So I'm here to introduce Dr. Huan Dong. He's a pediatric medical fellow at UCLA David Geffen School of Medicine. And he was a GloCal fellow, I think it was 2017, I believe. And he had an opportunity to work at the Hanoi Medical University. And I got to meet him a few years back, and I'm really glad that he's here to share his experience, his career journey, including his GloCal fellowship. And I'm really happy to have him here. And as before, I think we have till 8 o'clock. So maybe we'll have at least 10 minutes for question and answers. And as you listen to Dr. Dong share his experience, you can also, put your questions and reflections in the chat button. So I'll turn the floor over to Dr. Dong.
Great, thanks, Jay. Nice to meet you all. Thanks for joining me this morning. I am going to share my screen. Let's see. Let's see if I do. How do I do presenter view? Is that? Sorry, let me figure this out really. Show presenter view. Do you guys see presenter view now, or is it just me?
We just see the, try advancing the slide and see if it advances. Yeah, it's fine. So we see the presenter, I mean, the slideshow.
Okay, so you don't see my notes?
No.
Okay, perfect. Great. So thanks everybody again. My name is Huan Dong. I am currently a first-year pediatric infectious disease fellow here at UCLA David Geffen School of Medicine. My GloCal fellowship was during the 2016-2017 year in collaboration with Hanoi Medical University in Vietnam. I think, I kind of outline of this talk is going to just first share my experience. I think I had a pretty unique experience in developing the project and just where the ideas came from, and the kind of surprise that I had when I received the fellowship. And then I wanted to transition, this being the last, or maybe the last session here. I wanted to take the time and maybe go beyond the science a little bit. I know I've seen some of the previous presentations talked about, prepping grants and the scientific methods and kind of the methodologies of and the logistics of academia and research and whatnot. And I wanted to highlight the important work that we all are, the important role that we all have in this as trainees and as trainees looking to do global research, and just overall medical training in itself, and the importance of not only focusing on the science but on the individual and the experiences of the individual, and not only in professional development but personal development in this case. And so I just wanted to preface with that. And so with that, I'll just start with my journey. I have a very non-traditional background. I studied theater in undergrad at UC Berkeley, and throughout that time, I did a lot of health education afterwards. I did a lot of English teaching, STI, HIV work, volunteering at free clinics. I've been to Vietnam to do some of that, Tanzania, and other instances. And really, really unique experiences. Like, this is one of the most unique experiences. I worked for like 6 years with Kaiser Permanente's educational theater programs. So I was a health educator, but I did plays and musicals to help put social context to health issues for kids. And it really was well received. I saw like 70,000 kids a year. And it was a really interesting part of my background and development. And you'll probably see as I talk about my later part of the presentation how important I think the journey is in doing the medical research itself. And just a little brief, oops, briefly, I mean, it just, I didn't have much research before GloCal, actually. I started with some chart reviews for a pharmacy resident when I was in grad school at Columbia. Then I did a little bit of qualitative research for New York City Department of Public Health. And then I did a meta-analysis, systematic review when I was at Columbia for my master's as well, and another systematic review. So a lot of literature review, a lot of chart review, things like that, and not a lot of clinical or other translational projects. But I had only that, but I didn't allow that to really stop me from, really pursuing the GloCal. And it's a very interesting story because I think my idea for my GloCal came from a very personal not personal, but like kind of just a friendly platonic interaction that I had with a colleague that I worked with. And so I was a first-year medical student. I went on a short training program to Hanoi Medical University, and I met a friend who I got to, he was a community outreach individual at Hanoi Medical University at the Sexual Health Promotion Clinic. And he came to me for medical advice and said, "Oh, I have this runny nose, I have this low-grade fever. What antibiotic should I take? You're training to be a doctor." And I said, "Well, I'm just a first-year med student, but it sounds like you have a viral respiratory infection. I don't think you actually need antibiotics right now. Just, wait a couple days. Let's see how it goes. You'll probably get better." And he was like, "What are they teaching you in America in this medical school? I need antibiotics now." And I said, "Wait, let's just see. I'll buy you soup. I'll buy you food. Let's wait on the antibiotics." And I think I delayed antibiotic consumption for about maybe I don't know, 20 hours for this individual. The next morning he comes in with Cefixime and Augmentin in his hands and is taking this. "I feel so much better," he says. And I said, "Wow, are they teaching me the wrong things in med school?" I don't think so, but it was so interesting to see that interaction where there was such community use of antibiotics, and to be able to get a lot of antibiotics without prescriptions, without much challenges, was really surprising to me. And so I thought about that because I'd been a STI, HIV testing counselor and educator. And so I thought about, all the cases of hard to treat gonorrhea that I was seeing. And so I thought about, how does that impact things? How does this environment where there's a lot of community antibiotic use, how does that impact things like resistance? I think there's impact, but how do I show that? How do I prove that? How do I get data so I can maybe show it to my friend later on and say, "Hey, maybe we should wait to take antibiotics." And so I kind of put my personal experience together with kind of my background in STIs and HIV prevention, and kind of synthesize those ideas a little bit. And so I did a lot of research and my own kind of literature review as this young medical student, and found some interesting concepts. I want to share that with you all. And so there's this commensal reservoir hypothesis, right? We think about resistant gonorrhea. How does that come to be? So at the very end here, there's antimicrobial resistant gonorrhea. But so far, some of the genetic analysis revealed that some of the genes and genetic variables associated with antimicrobial resistant gonorrhea came from other Neisseria, other bacteria in that genus. And I was like, wow, that's interesting. So gonorrhea's cousins are sharing some DNA with the gonorrhea, and how does that happen? And how do the other Neisseria, gain resistance and to be able to share? So I did a little bit of digging and found kind of this hypothesis and pathway. So the thought is, there's commensal Neisseria that just kind of hang out in the throat. There's not a lot of research into commensal Neisseria because they're clinically irrelevant, meaning that they don't really cause disease. They just, are part of our oral microbiome. But, with environmental stressors, antibiotic consumption, the theory is that they can become resistant first by a bystander effect. So, they are always there. They live in tonsillar crypts and the posterior oral mucosa under our tongue, between our teeth, things like that. And when somebody takes antibiotics, not directed towards Neisseria, maybe they are influenced, they're stressed out, and so they become, maybe they develop some resistance, or their, colonies or the communities of Neisseria develop some sort of resistance. And when then gonorrhea may be, concomitantly or at the same time be in the throat with some of these Neisseria commensals, the thought is there's horizontal gene transmission, so that the genes of resistance come from these commensal organisms that maybe have lifetime, collection of resistance building up because of antibiotic use. And when there's gonorrhea there, it can transfer pretty easily. And we know that gonorrhea is actually able to uptake genetic information pretty well. And so that got me really, really thinking about how can we, because these last two steps are kind of already identified, how can we explore more of how, the other Neisseria are becoming resistant, and could they become tools for us to use to study the resistant gonorrhea itself? And so I put together this really cool team of people that were really, really supportive in my exploration and journey into this GloCal. So my primary academic mentor was Dr. Jeffrey Klausner. He is a professor of infectious disease and public health now. He's at USC. Before he was at UCLA, and before that he was the STI director at San Francisco. So he's, an expert in STIs, gonorrhea, and using technology to detect more resistance in STIs. My mentor on the ground in Hanoi was Dr. Zhangmin Lei, and he has a PhD from Columbia. He's an adjunct faculty there. He has tons and tons of collaborators, OHSU, UNC, UCLA, Columbia, and brings those collaborations to Hanoi Medical University. So he was really foundational in being able to do this research as well in Hanoi. And also the incredible Dr. Folasad May, who is I think now an associate professor at David Geffen School of Medicine, and does lots of global health projects, and director of quality improvement, as well as equity, diversity, inclusion efforts here as well. So really, really important people, prolifically academic people to help, help me guide my GloCal in this as a young medical student. And so here are my GloCal sites. I was at Hanoi Medical University at the Sexual Health Promotion Clinic. I did my laboratory work at the Tropical Medicine of Infectious Disease and Hygiene. I went to community sites and did some of the work at, bathhouses, parks, massage parlors, and other LGBTQ community centers. And then also back at the school at UCLA. I like this because I kind of had a friend help me create this graphic for my study. I wanted to be official. So I called my study the icon study. I wanted to be a little bit trendy, but this actually stands for the impact of cephalosporins on oral pharyngeal Neisseria. So I called it the icon study. And if you are into microbiology, this the eye of the icon and the graphic behind it might be really reminiscent for you of this e-test on this agar plate. And so I thought that was really fun that I was able to do that, and it kind of inspired all the microbio people, and it gave a really cool name to all the support and research assistants that I had also. So what I basically did was I did surveys that were heavily kind of verified and reviewed by my colleagues on the ground in Hanoi, just for cultural appropriateness and for language, because I turned this like 60-something question survey from English into Vietnamese, and I included a digital consent form on here as well that could be printed later on or emailed to the participant. So that was really, really cool, because I could take that into places where people who may be at high risk or in marginalized communities like the LGBT community sometimes don't want to come into an official health clinic to be part of the research. And so being able to go into the community was an essential part of my project as well. So I did that, collected some of that data, the background demographic data, qualitative data as well, and then I swabbed people's throats. I cultured all that in the lab. I learned a lot in the lab, and we did MALDI. We identified Neisseria species, then we did antimicrobial susceptibility testing on them. And I'll just briefly, because it's not really important, I'll just briefly go over some of my research findings and whatnot. But I was actually the first study to find Neisseria in 100% of my samples. And that's because I did my research and I personally delivered all these swabs over to the microbiome lab on my little motorbike by 4 p.m. every single day, because I heard that I read that these organisms were so hard to grow, and I wanted to get a good yield because before I started this, I didn't know if any of this would grow. But I was able to get 100% yield in every single participant because of I think my tenacity of getting these samples over within like 4 hours of collection. The results aren't really important, but I found a lot of resistance, and I found a lot of resistance, especially in those who took antibiotics within the last 6 months. And it kind of proved my point that antibiotic consumption overall induced resistance, especially cephalosporin resistance, of what we're concerned about in gonorrhea. From all different types of antibiotic consumption across over 200 individuals that I tested. Or was participated in this study. And so it was really, really interesting how I was able to do this all in 1 year. And I was not only proud of myself, but had to really reflect on how I was able to do this. And it was through a lot of support from individuals beyond myself, a lot of support on the ground. And I really want to emphasize that later on too. But yeah, those are my research findings. And so, yeah, going back to this commensal reservoir hypothesis, I think I was able to demonstrate some of this here. I demonstrated that commensal Neisseria were there in the oral pharynx, as opposed to just being tossed out, because in some of our medical clinical laboratories now, we have agar that has antibiotics on it that selects against, because we don't really care about the commensal Neisseria when we're in the hospital, because they usually don't cause disease. And I was able to show that the other Neisseria species also kind of had reduced antimicrobial susceptibilities. So I try to put together the stepping stone of the research, and I continue today to try to continue to highlight the links in between all these steps. But after the GloCal, how did I fare? How did the GloCal impact my professional development here? And there was a lot of post-fellowship achievements that was able to come from the GloCal. So I got a lot of publications, several first author publications, not only full manuscript articles, but also brief reports, commentary on other people's publications, invited commentaries, invited responses, and letters to the editors that were also invited. Also got invited to review a lot of manuscripts that were submitted in similar veins. And so lots of opportunities came from just the publications itself, as well as the presentations at things like ID Week, other conferences. I got some presentations that were pretty cool at NIH special meetings, because my mentor was able to invite me and he wanted me to share my research or my progress that I had so far. Many presentations at the medical school, as well as other regional research meetings. Even media, some people in LA were really interested in my achievements and my connections that I was able to make during the GloCal year as well. And so a bunch of media, the skills that I learned, such as red cap and just interacting with young adults and adolescents, as well as just the community interactions I was able to have during the research year, just really prompted more research. People were really interested in my skills and being able to conduct some of this research, and also with the manuscript writing. And so not only was I recruited onto projects that had HIV and STI topics, but also in other ones that dealt with adolescent and young adult medicine, as well as maternal fetal medicine. And that was also new to me. And so as well as other projects that had data collection and technical aspects of data entry and analysis. People were really interested in being able to bring some of this tablets and other things in the community to, again, reach hard to reach populations. And I think that was a really big skill that I learned during the year that really helped me out later on. My professional development also was, really catapulted by the GloCal year. And so I received research honors in medical school, as well as in residency. I did more research in residency, and then, completed some of those reviews and invited articles that continued years after my GloCal year. I got, into a great infectious disease fellowship here, and had great interviews, just speaking with people all over during the interview process. And now I'm, a lot of students come to me, especially the students that want to do more research in Vietnam, especially at UCLA, who want to maybe go to Hanoi Medical University to do some research. I mentor a lot of students, and so that's been a rewarding experience to me as well. And I just published another article, again, the maternal fetal medicine, with some of the in a cohort in Brazil as well. And so lots of productivity afterwards. And so I really wanted to share some of the brief lessons learned. And I think, this being the last session, I'm going to maybe glaze over this part, because I think as I was initially setting this up, I was hoping to speak to people who are maybe less far along their GloCal year. But this being the end, I'm sure many of people here have already picked up on a lot of these topics. And so just overall, the planning is really important over here, creating a schedule with flexibility in mind. People, projects and people are going to run into unexpected, challenges and time delays, especially working in an environment you're not at home. And so having flexibility in mind, considering a pilot phase to kind of do technical runs or dry runs of how your research is going to come out, making sure all the logistics are in place. And then just also adding in buffer weeks. I think buffer weeks and buffer times throughout my schedule then and even now as, an ID fellow is really important, because things often take longer than we think they do. And so building in that extra buffer time is really, really good for catching up and not getting behind. I really emphasize this as well, speaking not only with your guidance, advisors who are, in the offices, and with the professors and doctors. I really, I encourage you to continue to speak with support staff and those who are going to be on the ground with you, because they have so much insight and experiential knowledge that maybe the professors and the and the academicians more in the offices have less of. So getting perspectives from both the people on the ground as well as those higher up can really support with your logistical planning and the kind of efficiency of your research. People in this group probably don't need to be reminded to stay organized, but I remember doing small things like sending regular updates. Maybe we can do this laser pointer. Can you see this? Sending regular updates and small emails was also really fun. Every Friday, I said, you guys did a great job. We recruited, our goal was 10 or 12 this week, and you guys recruited 14. Like, thank you so much. And just small updates and small points of achievement are really important and can really motivate and keep the momentum of research going. I also was able to do some extra projects in the country because I kept my ears open, and there was another fellow who was there while I was there during my GloCal year. They were in their Doris Duke Fellowship, and we had some similar goals and similar interests. And so we did this really cool community photo voice project for so the LGBT community in Hanoi as well. And that really got us further connected to each other as well as the community, building a lot of trust and supporting both of our research projects. My advice also is for academically, start writing early, even if it's just an outline, even if it's just notes, even if it's just random thoughts on a paper, on a Word document with some citations. I think, writing early gives you some kind of framework, and if things don't work, you can always take it out. But this really helps you stay on track, because it's really hard to write down all your thoughts after a whole year of research, and when you're trying to write up your paper and whatnot. So just try to start writing early. And the other thing is network, and connect with everyone you meet. While I was there, I got to meet a lot of people who were just visiting from NIH or CDC or PEPFAR or USAID, AID, just because I just kept my ears open, and the university, oh, we're having a guest from CDC today. And even though I wasn't necessarily involved in that, I made sure I said hi and introduced myself and said the reason I was there, and and just sounded really enthusiastic, which I was. And so I got invited to a lot of dinners and things like that, and furthered my networking. And so, be enthusiastic, be passionate about your work, and share your work with the individuals you meet. And I think everyone who I met who was an official or a professor or something else, or an officer at CDC or elsewhere, was really really engaged, and it really appreciated my enthusiasm being there, and I continue to be connected with some of those people now, which again opens up more opportunities. And so, those are my brief lessons learned. I know that, some of the topics of interest were, to talk about how to create a successful academic career in global medicine, and how to secure grant funding and whatnot. And again, I really want to focus on the other side of, balancing professional and personal life while doing this, and working across cultures, and forming really important teams, and really effective teams in your research. And so I wanted to move on to this kind of the part of my talk here. Sorry. And so I wanted to start out with this quote by Sir William Osler. So the practice of medicine, and just medicine, global health, health research, is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. And I really want to take this to light, or take this to heart, because I think, you're all here because you're very technically capable of doing the research, and getting the training. And I implore everyone here to think of yourself as an individual, your heart, and maybe less of your head in this prompt. Where is your heart in this? Where is your heart in where, during the beginning of this year to where you are now? This is the time of year when I know, towards the end of the academic year, this is the time when, being a medical trainee, when house staff or residents and fellows start really feeling the burnout. We really start feeling the weight of the entire year of training on us. And so where are you? I ask you, take a moment to kind of reflect on for yourself. Where are you on this journey? Because you are very important. You are an essential part of this GloCal experience. Maybe this research may not have happened this year without you, and the uniqueness of the project, and the uniqueness of the research results, and the just overall experience of the research may have been changed by you as an individual in this process versus somebody else. And so think about what this grant is for. This grant, I think it was clarified for me, because as a young medical student, when I received this, I was really scared. I wasn't shy to share that. I said, are you guys sure you want to give this to me? Because I'm just a young medical student. I have like 1 or 2, publications. Am I going to be able to carry out this year-long project? And they said, Juan, relax. You have a good idea, and you have good mentors. This grant is for training you as an individual to become the independent researcher in the future. And so that really clarified things for me. And that really put into perspective light that, even no matter if my results were not as robust as I wanted them to be, or even if they were, this grant is for me to realize how much potential, or how much I like even doing this type of research. And also the technical aspects of me being able to be trained by these mentors, and to get guidance by these mentors to do this research. And so I really reflected upon that, and I want to talk about some of the other kind of findings during a brief review that I did over the last couple of weeks, to be able to kind of put this into perspective more for me. And the first part of that is operational readiness. I think I always glaze over this part a little less, because again, you're at the end of your year, and so I think this maybe not be as applicable, but the competencies required for conducting and producing quality research in global health go far beyond just the academic and scientific spheres, right? They incorporate the aspects of research partnerships, which places humility, empathy, and mutual respect at its core. Conducting quality, respectful global health research requires an appropriate balance of operational readiness and technical, physical, and mental readiness. And this is by Dr. McDonald from the Canadian Journal of Public Health. And so just talked about some of this physical readiness, as well as technical readiness, as well as mental readiness, how this really sets up a project or individuals for success in global health. And so physical readiness is just, making sure that you're healthy enough to go, you're getting all the vaccines, and you're, managing and you're anticipating all the kind of hardships and challenges living in that space, maybe abroad. Technical knowledge is also really important, right? Technical readiness, do you have all your supplies? Do you have all this stuff? Again, this is less important as towards the end of the year. But mentally confident, are you ready to take on these challenges well? Are you prepared to be open and receiving and sharing the cultural humility to participate in some of this research? And so I'm going to skip over this because I think the next part is maybe with quotes and things from other people are maybe more relatable. And so this, I was looking for kind of articles that assessed experiences transitioning abroad, and in narrative, qualitative kind of research and qualitative kind of analyses. And this part first comes from a study in 2020 that kind of highlighted some the experiences of U.S. military spouses who had to relocate and some of the hardships there that they experienced. So just reading some of these quotes, I never had to pick up and move clear across the country and now a different continent. My worry was that things would happen. I wouldn't be there for them, as in their families, as far as his health issues or roles. If my mom or my brother, something happened, but I was excited to see what was going to happen next. Other people wrote, I think that being a minority in our situation here has really grown me in ways and opened my eyes to certain things in America. And so when we go back, I feel like it's going to be different for me, because I think this place, Italy, has such a way of changing you and growing you. So I wanted to pause here really quickly and see if anybody else had any thoughts when maybe they first were in country at the more beginning of this year or this academic year. Does anybody have anything they wanted to share, or just major highlights and major brief reflections that they had as they kind of start to settle in their host country? Or even the GloCal fellows who are from not the US, who came here. Anybody?
Yeah, feel free to unmute yourself or type your responses in the chat. Yeah, we're doing well on time, so. I gotta say, it's such an amazing journey you're sharing. Very inspiring.
Thank you. Okay, I think, it's really, I think, if you ever felt this way, I'll just move on. If you ever felt this way, I think, you're not alone. This is a common experience. And I think this is an anticipated challenge of moving and incorporating and assimilating into a different environment and culture and community. But I think maybe the ways of addressing these challenges are less delineated and less addressed overall. And so I wanted to just, briefly go over some of that also. So this study found that the kind of consolidated some of the challenges as, adding stress to an already stressful situation, right? This is a military, relocation. So stressor already because somebody's being deployed. And so that's the really stressing situation. But moving to a different place where you don't feel maybe as even safe as you do at home can add to additional stress, right? Managing a new set of worries and fears surrounded by the unknown. I think this is also common. We can anticipate challenges as much as we want, but there are a lot of unexpected things that happen. And being able to be flexible with those challenges is really important. Third is reestablishing an everyday life from chaos. We're creatures of habit, as the saying goes, right? And so we really love our routines and we feel safe in our routines. But when our routine gets upheaved and we're in a completely different environment with many variables that are outside of our control, it can really feel like chaos sometimes. and accepting that and acknowledging that is okay. Also battling social, personal, and physical isolation. I think this is not a unique situation to the U.S. military spouses, right? I think many of us can feel this way, especially in the beginning, when we're in a new place. Reinventing myself to move beyond simply functioning to control. I think hopefully that many of you have experienced that as well as gaining some of the control as you become more familiar with your setting, and then pondering about life, returning, and repatriation. After a year being abroad, or many months being abroad, how is the return in a couple of months going to be? How is it going to be returning to clinical practice? How is it going to be going back to the research lab at your home institution after you've been so creative in your host country? So all those things are important factors here. And the goals that they've identified in this manuscript was, strengthening resiliency. How do you bounce back? How do you reestablish yourself from the chaos? How do you battle that social, personal, and physical isolation? Building cultural flexibility. How do you, reinvent yourself in that new environment? How do you manage those new worries and fears from your new setting? And then also maintaining health and well-being. This is really, really important. And when we're in a different environment, sometimes this can be really, really hard, because you can maybe feel that so many variables are out of your control. And so I wanted to speak to resiliency a little bit, and I found this narrative review or inquiry of a doctoral student's study abroad experience. This was a Chinese PhD in sociology, I believe, students kind of reflection called Tears and Cheers, and their journey. And so they document this journey about when they first came and they moved into this place. There was a girl who took a shower at midnight every day at the room next to her, and it was really noisy, and she couldn't handle it, and it really annoyed her, causing increasing tension to her nerves. Every day, my nerves were very stressful, increasing more sensitive to any sound around me. I tried to adjust myself, tried using earplugs, tried listening to music, and tried doing more exercise during the daytime, but they all seemed in vain. So after living there for 6 months, I left that house and moved to a new place. And there were some consequences to that, but they were really annoyed. And acknowledging that and really reflecting on how that impacted their mental well-being and their stressors, was actually a good thing, and helped them remove themselves from the environment that they felt that they couldn't be productive. And so taking maybe some control of that chaos, even though there are maybe some financial consequences to that. There's also another aspect which I can also relate to. I seem rather seriously disturbed by other people's messages requesting me to do something. For example, asking me to translate an abstract for them, to buy something for them when I go back home, to even buy milk for their babies, and so on. I'm assuming that's like in the country. If I refused to help them, they would probably be angry with me. But however, if I agreed to help them, that would make me feel very distracted and stressful. So I was overwhelmed at things that I could not concentrate appropriately on my research. I felt greatly relieved after that, and also learned how to deal with such a situation. And, when you're abroad, there may be other various factors, the people that you stay with, the community that you're interacting with, and even the people back home. There may be some requests and demands on you as this great global health researcher in country. You have this great, fellowship, and so you are capable of doing so much, so you can help everyone, right? And I think, there's also a reflection needed here to see how far can you stretch yourself and how far can you help others without impacting negatively on your own productivity and your own life. And so that reflection is also really important here. Another reflection that's really important is, as we start to feel the weight of everything, there may be imposter syndrome, there may be some pessimism that comes up. And so the quote is, "Are there any other things worse than what happened during these days? People say things would get better if it cannot be worse. I do think some things need to be changed and hope it will improve in the future." right? There are days where we'll have bad days. We have really good days too, but there are days where there are bad days, and to reflect upon that and to try to build resiliency in those moments, and talking to people, getting advice, speaking with your mentor, speaking with your family and friends to try to resolve some of those things are really, really important. And it's really important not to just kind of ignore those challenges that we deal with, because they can come up again and again. And so I think addressing it appropriately and to help you as an individual move on from some of those challenges is also really important. I think here this is a really long quote, so I won't read it all, but basically this quote says, like, family was really important to this individual. It was a really a source of homesickness and a source of stressors, because this individual couldn't be home with their baby, who was, I think, 10 months at that time, as well as their spouse. But being able to connect via video chat and via, just other digital communication was a source of support. And so, your family and friends back home can be a source of stress as well as a source of support, and acknowledging that and balancing that as well can be really important. I really like this next quote, because this individual also, I'll just read it. I had learned many times in the past few years I had how to swim, but I did not succeed. So swimming was a big challenge for me. But with my flatmates' encouragement, I could finally manage it. This was indeed cheerful and fulfilling for me, not just because I learned a new skill, but also enhanced my confidence of working on something that I thought was impossible. Since then, I also had irregular exercise activities and sometimes went swimming by myself. And so again, we talk about the science that you're there to do, but also you as an individual. What are those other factors that you can experience as an individual that will help promote the academic productivity that you have? And sometimes these can be really, really unconscious things. And finding ways to achieve and building confidence and resiliency in yourself as an individual can really help with your academic productivity. How is your research going? That's such a question that we get all the time, right? How is it going? How does that, what do you first think when you hear that? How did you think about that question when you were in August, say, versus now in May? What immediately comes to mind? Are you nervous to answer that question? Are you excited to answer that question? How much detail should I include? Are you a professional? Are you a lay person? All these things came to my mind, I know, when I got this question. So I just wanted to kind of contrast two ways to kind of think about this. So how's your research going? It's okay, slowly. I used a mixed method research. Now I've just finished my quantitative data analysis, but I haven't begun the qualitative part yet. Good, I'm not alone on the slower side. Which year are you in your PhD? Oh, I'm approaching the end of my 3rd year. Oh, you're doing fine. Most PhD students need 4 years. Oh yeah, I'm in the beginning of my 2nd year, and I've already completed the quantitative section of the mixed method analysis. And then that's on one perspective. And looking at the other side, how's your research going? Well, it goes very well. I use a mixed method research. Now I've finished my quantitative data analysis and will begin to do the qualitative part. Other person says, oh no, I must be the slowest one. I'm so upset. Which year are you in your PhD? Well, I'm in the beginning of my 2nd year. Wow, you're going very fast. Oh no. And the other person thinks to themselves, oh no, I'm approaching the end of my 3rd year and I'm still doing the quantitative section of the mixed method analysis. I think this really highlights, the position that you are in relation to how you answer this question, right? And we see between these two kind of scenarios how in one aspect, different students or different trainees of different stages of their career and research journey can answer this really differently. And hearing how other people answer this can make you reflect on yourself and think about, oh no, am I too slow? Am I too fast? Am I better than this person? Am I worse than this person? It's really easy to compare when, amongst yourselves. But, think about how useful that actually is. Comparing yourself to another person who may not even be doing the same research and who may not have the same background as you may not be as productive as, comparing yourself to your own kind of markers of achievement and success. And so, this article also highlighted the importance of resiliency and having peers and mentors and connectedness with your home institution. Sometimes I, just zoomed into some of the things I had at home at UCLA because I wanted to feel connected. How can family be the root of emotional distress as well as profound supportive factor against emotional distress, right? Family and friends, as we discussed, can both be both. And resilience building. How can you build and form the environment around you that you feel safe to kind of take on those challenges and be prepared for anticipating other challenges and working through and learning from these unanticipated challenges throughout this. And so I wanted to, kind of wrap up with the importance of reflection. This is actually, I just found this morning, and this is from Tracy Wells, who is is at UCLA also, and the group here, as well as some people at USC. And they found that reflective writing was a really, really useful tool. They did it with medical students, and I have a thing for residents as well. But this, for medical students, it's helped them reflect on how their global clinical rotation might influence their future career as physicians. Reflective writing also illustrated the knowledge and skills they acquired as physicians in training. And actually, it was very interesting. They assessed that these reflective writing prompts they learned that the medical students were able to reflect and demonstrate learning in all AAMC competency domains. So the competency set up for medical schools for achievement in medical schools was actually been able to extrapolate from some of these assessment or reflective writings. So it's very interesting to see that reflective writing for kind of resiliency and personal reflection we can even tease out a physician's preparedness in fulfilling some of these competencies that the AAMC has set out for medical students. Similarly, there is this reflective writing essay from I think like over 30 internal medicine residents at Johns Hopkins University. And the reflective writing exercises prompted deeper reflection, helped them find motivation to improve and increase awareness of their progress over time, as well as reevaluation of their priorities and values. So some quotes that I highlighted here are, just being able to write, what I'm thinking is therapeutic. I spend all day asking people how they feel and they are. It's nice to have someone ask ask me once in a while. So that reflection can be really therapeutic for the individual. The study or the prompt writing allowed me to be an observer of myself this last year. In fact, a lot of the negative and positive ways I've felt this last year are easier to remember since I've had to recall them over the months. I've become a fan and a rooter for myself by the end, like it's a sporting event. Right? It improved the motivation. This was motivation to improve. I feel that in participating in the study has been a positive experience by motivating me to improve on my clinical communication skills and also my relationships with my colleagues, patients, and family and friends, help them be a better communicator. And lastly, it has given me a chance to reflect. It is very easy to lose sight into the real reason why we went into this in the first place. Sometimes, it can be a really wild journey for research projects, for, kind of international experiences, as well as just overall medical training as a, health sciences trainee. And so reflection can be a really, really important tool here for us to see how we grew as not only the professional, but the individual, and so I just wanted to share. I had a really, really good time. And I think that's because I kept really, really true to myself. I knew I'd had to, surround myself with really awesome people and food to be able to achieve. And so here, I just wanted to highlight, this is my parents. I brought them to meet the research team. This is their first time in Hanoi ever. They've never been to Hanoi, given their kind of past history of growing up during the war. And so they were really great to meet and explore Hanoi Medical University. here is Dr. Klausner and Min, who I got to work with. We were presenting at a conference in Japan, and it was really fun. We took a run, all of us, we were all presenting that day. So we're like, we gotta, we're kind of jet lagged a little, but we have to do some running in the morning. And we found this castle in Okayama, Japan, and it was a really great start to the day before our presentations. And so really fulfilling our souls and our physical preparedness for that task. Just really having fun over here with my research team and the collaborators and the helpers in Hanoi Medical University. Here's me and Aparna, who was the Doris Duke Fellow. We ran in the Vietnam Mountain Marathon. I only did like a 10K. I did not do a whole marathon in Sapa, which was a beautiful setting. And so fulfilling, again, some of these other personal goals and other personal needs. Having really good food is also really important. Finding your favorite meal and letting that be a really good source of comfort really brought me joy to those days that can feel really long and arduous during the research. And just being silly, taking photos, having fun with your research staff, being not just a academic professional, but being a real person and being able to share yourself and finding time to find joy and to make joy and create joy and spark joy during your time can be really important. And I'll end with this quote. So nothing will sustain you more potently than the power to recognize in your humdrum routine the true poetry of life, the poetry of the commonplace, of the ordinary person, of the plain, the toil worn, with their loves and their joys, and their griefs and their sorrows. And so you're going to have great days. You're going to have bad days. You're going to have a lot of development professionally. I hope you also have a lot of personal, individual development, because I think that was what really helped me motivate me to continue on this journey and to really grow. And so this is my research team that I got to chance to do a photo shoot with. So thank you all so much. I'll stop there and for discussions and comments.
Great. Well, thank you so much. This was I think it was a very fitting last career development webinar for all of us. So yeah, we have like 7 minutes for questions. So I encourage you to unmute or put your questions in the chat. So this is an opportunity to ask questions. Don't be shy.
Hi.
Yeah,
Hi there.
Hi. I'm Dr. Avirut from. I'm a lower middle income country fellow from Thailand, and I listened to your session, and I feel that you have a lot of great experience, and thank you for sharing this to us. The first question for me is because I have quite different settings to you, because I like moved to. I have I have an opportunity to have time in the US for around 3 months there. And one of the things that I feel that quite different, because when we move to another place, that because you have like other fellows who work in research as well. But for me, I still feel that there is no other in the same level here in the US, because most of the fellows are from US and distributed to other countries. So the question is, how long that you take your time to adjust yourself in the new settings in Vietnam, and how can you connect with the people, because for here we have a lot of work in virtual settings. Most of the working is in virtual, but I think I don't know. I understand that at that time you visited Vietnam would be like there is no COVID-19, there is no virtual meetings. So how long that you how long did it take when you visit Vietnam, and how can you develop the connections to other people in the settings of virtual settings? This is two questions, right? And another one is about the back to, because I understand that you have clinical practice as well. After you leave for like very long time for your research, how can you adjust yourself to go back to the settings of clinical practice again? Because for me, I feel if I need to do the clinical practice, I feel not that confident as before, because I live in the clinical practice for a while. So I just would like you to share more about that.
Yeah, thank you so much for asking those questions. I think those are really important questions, and I think you're going to be more of an expert in that other exchange of coming from an LMIC going to the US for some training. I think I think you would have that experiential knowledge much more than me. I think it took me several months to be able to really assimilate. The good thing is actually because at UCLA I had an opportunity to spend about 3-4 weeks there the summer before I got the GloCal. I actually already knew about half of my research staff I ended up working with. So that's the story of the people that prompted my research, right? That's the story of one of those individuals. And so I thought about them all the time while I was developing my project. I communicated with them through email, through other things, while I was asking ideas and ask myself, can I even do this project over there? What are the resources? And so I was in connection with them the whole time. So I think I was in a very lucky and opportunistic situation where I was able to connect with them briefly for a couple of weeks as an introduction, and then kind of develop the project with them in mind and with that clinic in mind. And then so that when I came back, it was almost like a reunion and just a joy. And I was able to pretty quickly work with them. And I know that's not everyone's experience. And so I actually don't have like a data supported time frame for what it takes to really assimilate to another setting or situation. But I think some of the concepts of being open and enthusiastic and passionate, and just speaking to everyone you meet about your goals and what you're doing, what you're trying to do, and your hopes can help people understand where you're coming from, even though they might not understand it fully. They can see how interested you are, and if, let's say, they know somebody else who's interested in something similar or whatnot, they can introduce you to them. Let's say, like I like to do rock climbing, and I knew my friends there didn't like to do rock climbing, but I kept telling them, oh, I really like this. And they're like, oh, actually, I have another friend who likes rock climbing. I'll introduce you. So, putting yourself out there can really help people connect you to others, right? You don't have to meet everybody directly. But I think, as a visitor, you'll also be, people will also try to help you, connect you to their local community, and to whether that's in the, actual community or in an academic sphere as well. I hope that partially answered your questions. I think they're really good questions, and I think, again, if you have insight about that other side of the exchange, coming from an LMIC to the US training, and maybe in the future you can kind of reflect upon that part in a future session for the GloCal and the Forforgity.
So it's 8 o'clock here in Los Angeles. So last opportunity before we close. Any other final thoughts? This was a really great, I really enjoyed you sharing your experience, and this will be, obviously it was recorded, so we'll share with the other GloCal fellows who weren't able to make it today. Sure. But I really appreciate you, and thank you.
Of course.
All right. So this is the last seminar, and then I think we have works in progress next month in June. So I look forward to hearing your research. All right.
Put my email there just in case anybody wants to email me for any questions or wants to collaborate for any research also. So yeah.
Great. Thanks again.
Bye, everyone.
Bye.